All right, answer this question.
All right. The nurse is caring for a client who has a chest tube attached to a closed chest drainage system. It will be a priority for the nurse to monitor the client for. Okay, so the nurse is caring for the client who has a chest tube attached to the closed chest drainage system. So these are the options. So we're looking for the priority one. One, tracheal deviation. So already this is a red flag for me because if a tracheal is deviated, it can cause issues. But let me see the rest. Pain at the insertion site. Of course, we expect pain at the chest. Okay. 3, subcutaneous emphysema. That one is I will eliminate. And then 4, redness or swelling at the insertion site. So this is also a red flag for me because if there's any redness, there's swelling, it's warm, that's indicate an infection. So 1 and 4 now is my priority. So I have to choose one between 1 and 4. So I will go with 4 because the patient is at risk for infection. So I'll choose 4.
I'm surprised you are choosing 4 in this question.
And I know it's 1, it's tracheal deviation. I told you already because I know that's a
So
that's a bad thing. But why did they have to put 4 too to confuse?
that's what I'm trying to tell you. You remember when we're answering a particular question, I said, don't read the question with emotion. Read the question to life-threatening situation. And we talk about what? CNR being your level 1.
Yes. So that
Now,
number 1
your
is
level
exactly
2,
that.
right? Your level 2, which have to do with immune, is in level 2. Immune is in level 2. Trachea is airway. Do you know that? That is your
Yeah.
respiration right here. This is immune. This patient cannot die very soon. That's your level 2. You prioritize level 1. CNR, this is respiratory. This is immune. This subcutaneous emphysema is and these two, they are expected finding from the site. They are talking about the site. The site. These
This
are
side.
just
Yeah.
talking about the site. These are less priority. This is the one that is life threatening here. The 2. But when you are trying to prioritize, you cannot prioritize level 2 situation over level 1. This is airway problem. This airway problem, trachea deviation is not even in the
Deviation.
midline again. It's to the side or maybe to the side. I don't know where. So how will the airway now work? This is a big problem. You understand? So that's
Yeah.
the main reason why I gave this principle, because this principle will guide you towards selecting the answer. You don't need to use your mindset to be thinking about the question. Follow principle. Principle is the one that guide nurses. Nurses don't use their own self-thinking. It's principle. They are principles. Okay, I have a patient that's having this, and the question is telling me to select priority. I'm not going to read with my emotion and say, tracheal deviation is this. All I just want to know is what is tracheal deviation and what is it related to. Tracheal deviation is a airway problem and is related to respiratory. So if I'm trying to prioritize, I always think about prioritizing CNR first. And is it related to CNR? Yes, I will keep it.
Yes.
I'll go to the next one. Pain in the incision site. I told you yesterday, incision pain is not priority. It's expected when you have an incision, there's no insertion or incision site. I mean, incision site is expected to experience pain. So these are mild situation. Subcutaneous emphysema is expected for chest to mild situation. But infection to the site become a problem. But guess what? We have two main problems, but the question is which is priority. Now, what will guide you
Priority.
is
Yeah.
not emotion, right? What's going to guide you is not emotion to what you are feeling about the patient. It's about principle. And principle states that your CNR should be the first, then other things can come in place. So infection can wait, but that airway problem can never
It can.
wait.
Yeah.
Am I making sense?
Yeah, and I knew exactly that was the answer. I don't know why I chose
I was
4.
surprised because you said that in
Yes.
the first place, and I was
Yeah,
like,
that's a
wow,
red
she said
flag. I
4.
know.
Wow. Always stick to the real thinking related to the question and the principle. Don't navigate and use emotion. Let me see if
Yeah.
there's another question. All right, answer this question.
Okay. The nurse is assessing a newly admitted client who sustained partial thickness, second degree burn to the anterior thoracic in a house fire. Which of the following findings would require immediate follow-up? Okay, let me go with your instinct. Immediate, that means which is a life-threatening, which requires something to be done that can make a patient die. So dizziness and confusion. So that's neuro. Hypoactive bowel sounds and nausea. That cannot make a patient die, right? Vesicular breath sounds throughout the lung field, so that falls under respiration. And pain rated 5 on a scale of 10, 0 no pain and 10 severe pain. So I will eliminate 4 and I will eliminate 2, the bowel. So I'm left with 1, dizziness and confusion. So that's neuro, but this one talks about respiration 3. So when I'm looking at respiratory and neuro, I will help the person with the respiration and then go back to neuro. So 3.
All right. So let's go over the question together. Now it's saying the nurse is assessing a newly admitted client who sustained what? Partial thickness bone to the anterior thorax in a house fire. Now, one thing when we are thinking about bone, right? We are
Mm-hmm.
thinking about, well, we don't really need to add those thinking, but normally it's a basic understanding you should know about bone. When you are thinking about bone, we are trying to what prioritize what first. We are trying to prioritize the airway, breathing, circulation. But me, I don't like using this principle because it only limits you to respiratory and cardiovascular. I like using the cardiovascular neurorespiratory because I'm exposed to cardiovascular, respiratory, and neuro, right? Neurorespiratory, because under respiratory you can have the airway and breathing. We have the circulation right here, and you can add neuro because neuro is always important as well. To remember, what keeps the body working is the neuro. If anything is wrong with the neuro, that's a problem. That's why we have this triangle right here, whereby neuro is
Mm-hmm.
the leader. You have cardiovascular, respiratory, because
Mm-hmm.
cardiovascular can affect the neuro, respiratory can affect the neuro. So neuro, right? If it is damaged, then all these things will not function. And all that body system as well too will not definitely function under your level 2 and level 3. Right. It's just like right now. Imagine your cardiovascular is not working. Guess what? And then they tell you, oh, there's no supply of blood to the patient's leg. Guess what? The patient leg gets to be dark, right? Showing that there's no blood related to that area. And then
Mm-hmm.
the skin integrity get to damage, the leg get to damage, decay, and it become a problem. It's the cardiovascular that is causing it, right? As well too, if there's no signal that is sending to the leg from the neuro, guess what? That leg too can have problem in a sense that the
Mm-hmm.
patient will not be able to feel their any sensation to that leg. Guess what? They can easily get injured and they will not even know they are injured. And when they don't know, it become a problem, right? So this is how
Mm-hmm.
neuro can also affect the skin. This is how cardiovascular can affect the skin. You can say all this body system, every other body system rely on it. Same thing with respiratory. If respiratory, if there's no sufficient oxygen, cardiovascular will suffer from it, neuro will suffer from it. So this is how each body system affects themselves. But the three key body system that can kill a patient is your cardiovascular, neurorespiratory. Now, there's one thing on the NCLEX. NCLEX wants you to know. NCLEX wants you to know how to assess the body systems, the neurorespiratory, cardiovascular, and every other three body system. Right. So when I'm seeing dizziness and confusion, like you said, is related to neuro. What's the likely thinking when the patient is dizzy, confusion? If it's not
Oh, that's
related
low
to,
oxygen.
okay,
Okay.
great. You get the clue now. Low oxygen.
Yes.
Right, because there are different reasons why a patient can be dizzy, confused.
Yeah.
One, it might be due to condition, right? Now, a patient
Mm-hmm.
can be confused, dizzy, maybe a dizziness can be due to medication as well too. It depends on the medication, but this question is not talking about medication, so we cannot think about medication. Confusion can be due to condition, confusion, agitation, such as Alzheimer's disease. This question is not related to Alzheimer's disease. So the moment your dizziness, confusion is not related to medication, it's not related to a condition that caused them to have confusion, right? Trust me, the next thinking or the biggest thinking is what? Respiratory problem.
Yes. So
Because
that's
it's
it.
only low oxygen that can lead to what? Dizziness and confusion when it's not related to medication or it's not related to condition that should cause confusion. And burn is not a
Mm-hmm.
condition that should cause confusion. So the only thing we can tell is that this burn has affected the body so bad that it has affected the respiratory rate, and the respiratory rate has started causing problem to the neuro by not giving the
Mm-hmm.
neuro sufficient oxygen. So
Yeah.
keyword restless or
Mm-hmm.
restlessness, confusion, anxious, all these keywords scream what? Low
Yeah.
oxygen.
Yeah.
I put that on the PDF, right? That
Yeah. Yeah.
on the
I remembered
prioritization.
after I answered, I remembered that's the answer.
Okay, great. So that is the one that require your immediate follow-up. Hypoactive bowel sound. We have hyperactive, we have hypoactive, and we have no bowel sound. Hypoactive is not that good, but it's still better than no bowel sound. Imagine they tell you
Yeah.
no bowel sound, right? It's just like now. Look at respiratory rate, right? Low respiratory rate, high respiratory rate is still good than when the NCLEX tell you no breathing.
No breathing.
Patient is not breathing is dangerous, but if patient is still having low, high, we can still say okay, patient is still coping, but no breathing, patient is dead, right?
Yeah.
So same thing with bowel sound. Hypoactive, hyperactive, good, but no bowel sound, that's a problem. And nausea is still good, but vomiting it become a problem because they are at risk for electrolyte imbalance. But when the question is not really telling you they have started having electrolyte sign and symptom problem, then you don't really think about it as much. But you always wait when till there is a problem, except if the question is telling you to think about the risk. But if the question is not telling you to think about the risk, you don't need to think about the risk. So number two is still fine. Look at number three, right? Vestibular breath sound throughout the lungs feed. That is not a bad thing,
Mm-hmm.
right? So it's not a bad thing. It's normal. It's normal. It's a soft sound that is heard throughout the lungs feed. It is a good thing, right?
Yeah.
So yeah, it's not a bad thing. Right. So number three is out. Now, um number three, this is a normal finding, right? This is not a
Mhm.
bad finding. These are the ones that are problem. This is a problem, this is a problem, and the pain is a problem. But I told you on that document that if a pain is less than 7, we don't prioritize it. If it is
Yeah.
7 and above, we start to think about it. Even if this pain is 10/10, right? Even if this patient is saying their pain is 10/10, right? We are not still going to prioritize it over number one, because pain cannot really kill the patient. But we want to consider pain only when it is above 7. We don't consider pain. This patient is saying 5 out. That is not a priority. It's only when it's above 7 we start considering it. But even if it is 8, or even if it is 10/10 rated, we cannot still prioritize this pain over this one, because this one will be more priority than the pain.
Okay. Yeah.
Am I making sense?
Yeah.
Right, because the pain cannot really kill the patient, right? But if you want to prioritize pain, wait until it is above 7. Then you start comparing it with other answers, right? So this pain can as well to go, right? This can go, this can go. You are left with 1 and 2. Now, if you are left with 1 and 2, because you need, that's the reason why I was used to say this, you need to know uh abnormal breath sound and normal breath sound. Vestibular breath sound
Mm.
is normal, right? Vestibular breath
Mhm.
sound is normal. So that's what you need to know. You understand?
Yeah.
That's what you need to know. So vesicular breath sound is definitely normal.
Mhm.
Your
No.
abnormal breath sound are like your crackles, wheezing,
Using. Okay.
ronchi, stridor. Those are your abnormal breath sound. Am I making sense?
Yes.
Right. So when you see that, what were you thinking about when you saw that?
I saw confusion. I saw I didn't check the word as you said, read your words properly.
No, I mean
My
when you
mind
were
went
reading,
straight.
because you selected number 3. So I wanted to know when you read vesicular breath sound, what were you thinking? Like, because you
I
selected
didn't
that.
get the word vesticular. I just in my head the word came in just throughout the lung field. There was kind of it's my head, not the answer itself. I
Okay.
My head was telling me that there was bad breath sounds. That's why I
Oh,
took it,
okay.
but I didn't get the part vesticular and put it in my head. Yeah, it's
Yeah.
my bad. But I know exactly confusion, restless, anxious. You already mentioned in some of the video you said that this one's red flag means
Yeah.
low oxygen. It's a priority.
Exactly. Mm-hmm. Exactly. Right. This is very good. The bad one is what we call the adventitious
Uh,
adventitious breath sound. Adventitious breath sound is bad. Those are your crackles, your stridor, your wheezing, your ronchi, your pura rubs. Right. Those are your bad breath sound. But the vesticular breath sound is definitely a good one. So you need to know the
so if
difference between.
in my question is if it was adventitious breath sounds here and we had dizziness and confusion, our answer will still be one.
The answer will still be one, in a sense that it's still within the lungs. This will still be within the lungs, but this has left the lungs and started
Lungs and go
affecting
to the
the
okay
neuro.
neuron.
So that is a bigger priority than the one that is still affecting the lungs. Because
Okay,
when something is affecting the lungs and is not yet affecting other body systems, it's not yet a priority.
okay.
Right, but when it's affecting another body system, then it's a priority. It's not that it's not a priority. Let me just restate what I said. It's not that it's not a priority, but in this question, if you want to prioritize this patient that is having respiratory problem, and if this is adventitious, right, and then this is dizziness and confusion, this can still wait because it has not yet started affecting the neuro, but this cannot
Mhm.
wait because it has started affecting the neuro. So that's the reason
Mm.
why it's good. But if there is no dizziness in this question, let us say the question just said patient is alert. This is what we are going to prioritize as our answer. Adventitious breath sound. That's what if it is
Yeah,
adventitious. Am I making sense?
yeah.
Okay. So yeah, that is how you think about it. Right. So trust me, following all this key process, you will be able to like succeed on the test, right? Because NCLEX is
Mhm.
not difficult. It's just the way we think through it. The moment you have a clear way of thinking through it, and trust me, you will definitely succeed. NCLEX is not difficult. It's just the mindset we take towards it. It's just understanding the question. And what you have been able to do well so far, so good. You are able to understand your body, you are able to understand your stem, which is brilliant, and you're able to break
Mhm.
down the question. Now, the key interest, right, or the key need you need right now is to be able to identify the answers related to how severe it is, not related to
Yeah,
emotion, but related to special principle that tell you what is going on. Right.
exactly. Yeah.
So what I feel like you need right now is more practice questions so that you can keep building on those principles. Because the more question you answer, the more you are going to be exposed to that same principle. You have the thinking process now. What is just remaining is to start building on practice questions that test those same principle, and then you are going to excel on the NCLEX exam. Right.
Yeah. Thanks.
So I hope you enjoy the process.
Yes, I did.
All right, glad. So yeah, that is just everything about understanding the NCLEX, and definitely I'm going to see you another time. If you have any concern, any question, feel free reach out to me so that I can be able to like break it down for you, because you are part of the coaching program. You paid to get this knowledge, and so far so good. You should be able to get every knowledge you need in order to successfully pass the NCLEX exam. And the main goal is to pass the exam in minimum question. You saw the message I sent on the WhatsApp group today.
Yes, I saw, and I was like, I wish it was me.
She took the exam yesterday, day before yesterday. She messaged me, right?
Yeah.
She messaged me. She was like, "Coach, I am so bothered about the exam, because I don't know why I'm feeling this way. I just feel down, lazy. I don't want to read anything today." I said, "Have you watched the video that I asked you to watch for today?" And she said,
Mhm.
"Yes, she have watched it, but she want to practice question, but she don't feel like practicing question." I said, "You don't need to practice question. The problem is that when you feel like doing things by yourself, it become a problem. But if you can do it with somebody, the stress is out. When are you going to be available?
Yes.
Let's meet on Zoom." Then she said, "Okay, she'll be available. I should give her 2 hours. She's listening to a podcast." I said, "Okay, no problem." Now we met. around 3. That was day before yesterday. And then I broke everything down for her. She was pretty much doing great, following the same process, the same way you were following the same process. And then I said, okay, with this, definitely I'm confident you will be able to pass. She said she hope. I said,
Mm.
be positive. Right. Now, she took the exam yesterday. She came back. She was asking me if she got this correctly, this and that. Out of maybe 5 questions she told me she got on the exam, at least one was the one I said, okay, this was wrong. Right. Today, this morning, she
Mhm.
was discussing with me as well to telling me about more question. Also, one was one of those questions that she selected as well. So I told her the answer was wrong. But as of everything she discussed with me, yeah, I feel like she did great because she said she was 100% positive about every other question, and it's just the one that was concerning to her that she's asking me. I said, okay, it's no problem. The fact that you told me you're 100% confident, she even told me
Mhm.
she utilized everything I told her to use, and then it was very helpful on the exam because she was able to break down those answers. Because if I was not there to like point out those key things, maybe she would have been struggling with those questions. I said, wow, I'm happy
That's
to hear that.
nice.
When we were having our conversation, right? That was when she just told me, Coach, I passed. I was like, but we planned that you are either going to get your result in the next 48 hours or you are
Mm-hmm.
going to get it on Monday. Right. She said, oh,
Mm-hmm.
somebody told her that she should just go straight to the Board of Nursing website
Yeah,
and she'll be able to see it. And then when she
yeah.
said, oh, and she just sent me the screenshots. And I was just like, wow, I was
Oh
happy.
my goodness. I can't wait for that day actually. This thing
I'm
has been
telling you.
stressing me. Oh my.
I'm telling you, it's a transformation. I'm telling you, this is the transformation I want to give to every student. This student came to me like knowing nothing. She was unable to break down questions. I always used to tell her, I say, Katrine, I want you to focus on just the question. Don't overthink. She sent that message to me too. She sent it, says, okay, I will always focus on the question and nothing more. I was like, wow. Because when students are following a certain process and they trust a certain process, right?
Mm-hmm.
I like that a lot because I'm not going to misguide you in a certain way that it's not going to work for you. If I tell you something, it's 100% going to work, right? So it's
Yeah,
not even about me telling you something. It's about me telling you the approach at which you should be thinking related to the NCLEX. Because if you can think according to the way the NCLEX wants you to think, you will not be lost in the question. And I don't want
yeah,
her to be lost. That's what I was telling her. Focus on the content. Don't focus on anything else. Right. And maybe she was saying it to herself and she just sent it to me. Right. I will never think about anything else about the question than the question again. And then that was what she was doing. And look at the result now. She could not even concentrate. This and that. I said, okay, take today, take today as your day of joy. Because she's not concentrating no more. She was just like, oh coach, I'm so excited. I'm over the place right now. It's
yeah, of
overwhelming, you
course.
know. Yeah,
Oh
so
my God. But honestly, I see a big difference from my first exam and
mhm,
whatever I'm doing with you now. There's a big difference of me answering
I'm
questions. I
glad.
was there most of the question. I won't lie. I guessed. I didn't understand what I was, and I don't know why I
Mhm.
booked and I went. It's pressure from friends. Everybody
Yeah,
went and they finished. They're like, "You can do it. Just go." So
true.
it only took me two weeks to study. Just do McClemac. It's easy, and I did what they said. But I
Mm.
regret. But anyway, it's not late.
Yeah, it's not late. It's not late.
Yeah,
Right. Failure is not denial. Now,
yeah,
that's the truth. Most people they fall under pressure, they fall under this. But the problem is the exam exists, the content exists. It's what you know that matters. Because what
yeah.
you know might not exist at that point at which you are trying to go navigate the exam. So people don't know
Hmm.
what don't exist. They only just know what give you the result. But do you
Yeah,
have everything possible to attain the result? You
it's
understand?
true.
So, but if you have everything
Yeah.
possible to attain that result, you are going to succeed. Right.
Hmm.
That is just it. So you are in the right spot getting what you need, and then once you know that you've gotten everything you need and you go for the exam, you definitely come out with the right result. You cannot do the right thing and then come out with the opposite result. It's not possible. I'm telling you, it's not
Yeah.
possible. I can't even think about uh um the other aspect of doing something appropriately and then failing. I can't even think about it because this is how I reflect on most things I've been doing for the past 2 years. If I'm able to help a particular student who failed 14 times, a student that did not understand English as much,
Oh yeah.
I'm telling
That's a
you, and she
big
was able
difference.
to pass after 14 attempts.
Oh
Come on,
wow.
come on. That's
14.
the
Yeah.
if you listen to many of my YouTube video, you will hear me saying this. The reason why I keep saying this is because she's a big testimony to me, because if a particular student failed the exam 14 times from Philippines,
Mm-hmm.
not knowing so much English, she did not learn in the same environment as some students that learn in either Canada, US,
Yeah,
in
yeah.
Philippines, international students, and someone that is in the US that understand the system is struggling after one attempt, saying they are giving up. Nah,
Can you imagine? Yeah, no.
nah. This is the big motivation to me, because when I look at it, when I was trying to coach this particular student, let me tell you the truth, I was scared, because when she wanted to take her 14 attempt, she reached out to me 3 days before her exam. She said she loved the way I break down question. Can I help her with how to answer question? I said, I only break down question here, but that is not the main goal of my coaching program. My coaching program is to make sure that you know everything you need to know in order to pass the exam. So breaking down question might not be beneficial for you. You need a full coaching program, but you have 3 days. So I don't really know how I can help you. So if I break down question with you, don't really guarantee that you will pass. It what guarantee that you will pass is you know everything. And it will take me 60 or 30 days to be able to give you everything you need. That's what I told her. And I said,
Mm-hmm.
but I can try to break question with you. Let's just come on Zoom. She came on Zoom, and trust me, the way she was even answering those questions, I knew she will fail, right? But I just try as much as possible to encourage her. I said, okay, try your best, do your best. If you pass, can you? I was asking, can you change the date? She said, no, she cannot change the date. It's not possible again. I said, okay, no problem. Since you cannot change the date, let's see what will happen. I said, but the if you have happen to like fail the exam, right, I will encourage you to join my coaching program. And she said, okay, no problem. So she was still messaging me day one to the exam, like, what can you do right now to help me? I feel overwhelmed. I said, there's nothing much I can do for you. Then you should just believe in what you have been doing so far so good. I don't know what you have been
Mm-hmm.
doing, but what you have been doing, just believe in it. Right, because she has tried everything, what obviously 13 times. Obviously, I said, "What are you doing now?" She said she's in a particular tutoring in Philippines. There's a WhatsApp group tutoring that they are doing something like that. They share material. That's what she's doing currently, because she has tried every other thing. It's not working for her, so she have to stick to what her country is
No, yeah.
offering her.
Yes.
Right. So now, when she failed the exam, like 2 days, because I know results should be out after 2 days. I reached out to her. Right, I messaged her. I was like, um, "Did you pass?" Right, because she did not message me, so I reached out. I
Mm-hmm.
don't know whether it's 2 days or 3 days I reached out. No, it's 2 days. I reached out 2 days because I wanted to know the result that day. She did not reach out. So the third day, I reached out again. She did not reply. Right. I said, wow. If she
Was
did not
stressed.
reply, then it means that it's the opposite, meaning she did not pass the exam.
Yeah.
So
Yeah.
I did not reach out again for a very long time, right? But there was a particular time I was trying to like check something on my Instagram, because she messaged me on Instagram, right? So I saw
Mm-hmm.
her message again. So I was like, let me reach. I saw her name again. I said, let me reach out to her. I was trying to share something to somebody. You know, if you want to share, it's going to pop up people name that you can share to
Yeah.
or something like that. Me and that lady always used to have conversations. So Instagram tried to predict if I would try to want to send that particular thing to her, but I was trying to send it to another person. So I saw her name. I said, oh, let me reach out again. That was after 3 weeks. Then I reached out again. I was like, did you pass? You are not letting me know. If you did not pass, I can definitely be able to help you. Right? That was
Mm-hmm.
when she replied. That was the message she replied to. Now, when she replied, she did not reply because of I said I would help her. She replied to tell me that she has given up. Now she said
Oh,
she did
yeah.
not pass, but she's no more interested in taking the NCLEX exam. That she's sorry that she did not reach out to me earlier on. I said, why are you giving up? She says she know her problem. Now, so far so good. I've been coaching for the past 2 years, right? At that point, that was still my going to 2 years. Now I'm going to my third year of coaching experience. Now, that point, I have not heard a particular student that said they know their problem. It's always student that will say, coach, honestly, I don't know what I am doing wrong. I've tried everything. I don't know what else to do. They always used to say they don't know what they are doing wrong. But this particular student told me she know why she's failing. So I was interested in knowing why. So I said, okay, please, can you tell me why you feel you are failing? That was when she told me it's the English. When she was preparing for the 14 attempt, she did not tell me it's the English. I thought it was the content and all that kind of
Oh.
stuff. She did not tell me. It's now after now when she failed, she started telling me it's the English. That's what she has been struggling with. Then I sent a particular message to her. Trust me, the message I sent to her was just to motivate her I don't know if it's going to work because I don't know what she has been using. I just started coaching 2 years ago. Yes, I know my stuff. I have the ability to help any student to pass because me, I can definitely take the NCLEX exam 1,000 times and pass every time I take the exam. So I believe I can walk a student through that same existing process, right? And student will still be able to pass. I believe that strongly. So I believe if she can walk through that process, she'll be able to pass. But my fear was she has done this 14 times. She might have tried different things and it's not working for her. So what will now make it possible for me to be able to make her pass? So I was scared. But at the end of the day, my message was not even sounding like that. I sent her a message immediately. I said, the NCLEX exam is not an exam that tests you related to your English speaking. It's an exam that tests you related to concepts. So if you focus on concept, I don't care if you try to translate what the question is saying related to understanding the concept, you'll be able to pass. That was what I told her. She was like, don't worry, I'm going to give up this and that. She said, it's not even about the money, it's just the fact that she don't just want to waste her time. She just want to do another thing, this and that. I said, okay, you prefer to just work in Philippines rather than trying to work in the US as you wanted. She said, yes, that's what she will stick with because this and that. I said, okay, it's not a problem. If um paying me, right, will be a
Mhm.
problem for you to trust the process. Instead of paying me the $497 you want to pay me, use that money to
Mhm.
register for a new exam. Don't pay me. I will do this process for you for free. Right? Because my
Mhm.
spirit told me something. He said, if this lady can be a testimony to me, then it will tell me that there's nobody on earth that can ever fail the exam. So I walk through the process. Trust me. Like now, look at this question on the screen. Let me
Mhm.
show you one question. Let me go to one question that she had a problem with. Let me go to one question she had a problem with. You will break that question and I will tell you how she broke the question. You don't need to answer the question. Just all I just want from you is to just tell me the understanding of the stem. That's just what I just want. Just tell me the understanding of the stem. I will tell you what she said the stem understanding is all about. Question 2. This is the question.
Mhm.
Now you just read the stem and tell me the understanding of the stem. Or you can read the
Which
body
of the
anyway.
following actions by the staff member would require the nurse to intervene? So the nurse will intervene on the wrong thing that is being done.
All right. Now you understand it as the wrong thing. But when she was reading the her own, she said something that the nurse must do that is correct. She don't understand the
Oh,
difference between requiring to intervene and intervention. She don't understand the difference.
oh, poor girl.
So
Oh,
so I had to honestly at that point I didn't even know how to explain it to her. I was like, how can I explain it to her? I tried as much as possible to explain it to her. She did not still understand. I was having terrible headache. I said, okay, what can I do? And I don't want to like start translating in a language because she might, if she don't understand it, how will it be possible? Like I was just lost. So I just picked this statement. I went on Google Translator. I translated it for her to understand. And then she now said, okay, she understand it now. So now I crafted another question similar to this, sent it to her
mhm,
to make sure that she understand it, but it's a different question. She understand it. I also got another question, same thing. She understand it. And I noticed that, okay, if you can be doing this thing this way, it can be stressful to me, but at the end of the day,
mhm.
in as much you can get that result, I'm going to pack all these clues together. I'm going to use it to create a coaching program. Because then I did not even have a coaching program. I was just like teaching one on one, doing all those kind of things like that. But now, when I wanted to use that to create a clue, right, to what is working, and then I kept on documenting everything, documenting everything, documenting everything. Now, when she took the NCLEX
Yeah.
exam, and then she just came back and she just said, um, she passed the exam. I was like, wow, you passed the exam. Everybody that I've ever passed the exam, I started even like texting them. I said, wow, do you believe there was a particular student that passed the exam? I was so excited even than I that passed
Wow.
the exam.
Oh my goodness. That's nice.
I'm telling you the truth. So I just
Wow.
pack everything all together, created it, and I started working on them. I said, if any student can follow the same process, if this student can follow the same process, there's nobody that don't know the story.
Yeah,
There's
there's
none of my
nobody
students that
exactly.
don't know this story. I wish you to say it everywhere because it's the best thing that ever happened in my coaching experience. It is not a coaching experience that have to do with try and error that I'm trying to try what is working. No, I use a particular settings, a particular roadmap. I walk out through a particular roadmap, walk out through a particular step, that led her to that transformation. I'm telling
Wow.
you the truth. So yeah, that is definitely it. And at the end of the day, she passed. She sent me a new laptop, a whiteboard, and all those kind of stuff. I was
Wow.
like, thank you for appreciating that. So
It's,
yeah,
it's
so
so cool.
it's incredible when you give someone the transformation they need. Right, that is the good process. It's about changing their story, right?
Mhm.
Rewriting a new story, like taking them from struggling to what I pass. A lot of I struggle, they pass. There was a particular student, same process that I'm walking you through, PN. She failed in 85 question. She paid for 60-day coaching program, right, with me.
Mhm.
Now she only spent 2 weeks. She went to go take the exam. She was just screaming, Coach, I know my problem now. I know my problem now. I said, we've not finished the coaching program. Why are you rushing to go take the exam? She said she know her problem now. She will pass. I said, what's the problem? She said she did not know how to break the question. She know the content, but she did not know how to break the question. She said if she answer question now, she will pass. I said, okay, if you know your problem, if you are not ready to finish up, I'm not really confident that you might pass. I want you to finish so that I can be confident. But if you decide not to finish, let me give you the readiness assessment now. She did the
Mhm.
readiness assessment. First one, she scored like 48. Second one, she scored maybe like 47. Like her score is always 47 over 50 or above 47 over 50. There was a particular time she scored all 50. I knew this lady was ready. I said, okay, you can go take
Oh,
the exam. She took the exam the third week and then she gave me the results. She said, oh, I passed. She failed in it 5 question and passed in it 5 question. Let me tell you
wow.
something.
So
If
the
a
first time
student,
she didn't do with you. She just went, and then the
yeah,
second time you
she did
coach.
not do with me.
Okay.
Yeah. She did not do it with me. She just saw me on Instagram and she was like, oh, let me help out. Right. But we did not finish the coaching program. Just 2 weeks. She said she's ready, that she would already know her problem. So me, I was
That's
even worried.
nice.
I was scared. I was not wanting her to go take the exam yet because I was like trying to beg her to wait till the process finish. She said no, she will take it and pass. Okay, no problem. I don't have I cannot we are adult, right? I
Good thing
cannot
she
stop you from
believed.
taking. Hmm?
She believed in herself. That's
She
good.
believes, she believes. She
Yeah, I
believes.
told my friend too about you. Who there's one friend who's not done the exam. She hasn't even tried yet. After
Okay.
I failed, I told her. So she was like, "I don't know. I'm scared. I don't know. You just go ahead. Tell me." I said, "Okay. Do not join me. Do not pay. You stay. Wait for my
Mm-hmm.
result, and then I will connect you if you. But it's up to you. But trust me, whatever
Mm-hmm.
you're gonna do with this guy, there's no way you're gonna get in this act." That's what I told you.
I'm telling you. I'm telling you. Yeah,
It's
that
it's
please.
it's unique.
Wow. That's amazing.
Yeah, it's unique. The style is unique because I've been to Mark Lemak. Yes, Mark Lemak
Mm,
has foundational things,
yeah.
but it's not exactly the way you're teaching about NCLEX. Yes, you need to know your stuff. You need to know your maternity. You need to know
Mm-hmm.
yes, what Mark Lemak can provide you with, but not what NCLEX wants.
I understand. Yeah. My
Yeah.
clinic was part of those people that were writing exam right for the
Yes,
NCLEX.
yes, he
But
said.
when my clinic talk about most things about the NCLEX, he did not talk about it related to his teaching. He only talk about maybe related to interviews, podcasts, something like that. But
Yes.
people need to not only know content. So my clinic is more of the content, right? And telling you information related to the content. It's not about the information, it's about knowing how you write the question. So I don't know whether it's trying to hide the way they write the question, but the way they write the question is on the test plan. So it should be
Mhm.
more on, not more on the content, should be more on how you guys write that question. I had to
Yeah.
learn how they write the question to be able to understand the question. You can see that lady now. Our understanding about that question, this question is that something that is correct. Now, if you don't understand the question, you will think it's also something that is correct. But
Yeah.
because of you understand the question, you know it's wrong. You can see what's making her to get the question wrong is because she thought it's the correct answer she needs to look for, whereas it's the wrong answer we are looking for. So it's the understanding. So if Mark Clinic teach you about chickenpox, it will give you the information related to chickenpox, but it's not
Mhm.
giving you the information on how to answer any question related to chickenpox. It's only giving you
Yeah.
the content related to it. So when you go on the exam, people still fail because I've seen people that will say, "Oh, I use Mark Clinic and fail." Does not change the fact that Mark Clinic is not good or does not give the information. It's just that there's something about you that use that
Yes.
program that is still missing that you need to fix. Once you can fix everything possible, there's no program on earth that cannot make you to pass. Even terrible program will still make you to pass, because obviously when you see a terrible program, you are going to run away from it because you know what you know. You are able to identify a terrible program. So why would you use the terrible program when you know it's terrible? But if it's not
Yes.
terrible, you will start even learning from it because you have an idea of what you are doing. But if you don't have an idea of what you are doing and you just surrender yourself to a process, trust me, it become a problem. It's just like right now, a nurse that is bringing different medication to you because you are sick, and the nurse now tell you one statement: I don't know what all this medication is used for, but I just want you to use it. Are you going to take that medication from the nurse?
No.
Obviously no, because you have an idea that that medication can cause harm to you. You know the
Mm-hmm.
nurse is registered, right? You know the nurse do administer medication, but the statement that the nurse made you run away from taking the medication.
Mm-hmm.
Right. But guess what? Most people don't even have an idea of the danger behind using program without not having prior knowledge about the NCLEX. That is the reason why people just surrender themselves. If the nurse did not make that statement, you will open your mouth to use the medication. But because of that statement, that's why. So the statement that speak about you not gaining from a certain process is what we need to fix. What is that thing? Is it content? Is it how the NCLEX write the question? Is he understand it? That's what we used to tell students. The reason why most
Mm-hmm.
students don't pass the exam is these three things: content, knowing how the NCLEX write the question, and trying to understand it. The moment we fix these three things, every student do pass. If it is
Yeah.
content, you know the content, you still need to. I've seen people that know content and still miss the question. There was a particular student, right, who passed on her fourth attempt using me. Her problem was that she knows the content, right? Even according to her, she said that dad always used to say she's very smart because she can read and start stating everything to you from A to Z. But the problem
Mm.
that she had when she joined my coaching program is that she don't know how the NCLEX write the question and she don't know how to understand it. Content was A. She has A knowledge in content. But the writing, understanding how the NCLEX write the question and understanding how to break it down, that was what I taught her. And that way, she was able to pass on her fourth attempt. Right. So
Wow.
most of the time, it might not be content that student might struggle with. It might be a different thing. Most people might struggle with the three. Most people might struggle with just understanding. Most people might know how the
Wow.
question, they write the question. There are some people they don't know how the NCLEX write the question. But when they read the question, they reflect the writing style of the question. You don't need to bother them and tell them this is the body, this is the stem, this is answer key. In as much their reading style reflects the writing style of the exam, there's no need. But I only do that for students that their reading style don't reflect. If like now when you were reading your question, there was no any time that you read the answer and go back to the question. If I notice that, I will tell you you have a big problem. Because if any student
Mm-hmm.
is reading your question and they are going back to the answer, it means that they have not fully understand the question. Why would you read the question, come to the answer, and still go back to the question again, come to the answer? You are not like going back and forth. It means you don't understand the question. But if you follow the
Yeah.
process of understanding the body, you know the stem, you can see you've clarified yourself on the body, you've clarified yourself on the stem. So since you understand what
Mm-hmm.
the stem and body is talking about, you don't need to go back. And you never went back throughout when you were answering question, which is brilliant. So the initial problem that might be a problem, you fix that. The only problem now that I've seen that you need to just work on is
Mm-hmm.
understanding the answer breakdown. That's all. So far, so good. You are
Okay.
good with understanding what the question is testing, the examiner, and then it's just the breaking down. If you can, and the only solution to do that is practice more on the content, so practice more questions that will challenge your thinking process, and always
Okay.
think the right way the NCLEX wants you to think. That way you will find out that you are going to be undefeated on the NCLEX exam. So this is just the process of passing. It's very very easy, and I believe in you. Right, you are definitely
Okay.
going to make it, and you are going to pass.
Yep. For sure.
Oh, all right.
Yeah.
So if you
Thank
happen
you.
if you happen to like want to say a message to maybe somebody that uh they're also struggling, they maybe
Mm-hmm.
need a coach, they want a coach to help them, or maybe somebody that is watching my video and then they feel like, oh, can this guy really help me? What would you tell that person? Maybe they want to join my coaching
101.
program. They,
101. It's like you. I swear to God, I know people, a lot of coaches, a lot of I've heard about and everything, but and I nobody told me about you. Myself, I got it from YouTube. I was doing I'm just going through videos looking for ways of passing NCLEX, and I came across one of your video, and guess what? It catch me straight into my veins, and I'm like,
Wow.
he is the one I'm looking for, because I was looking for a coach, because I told myself I'm not gonna go back on a second attempt and fail again. I will be discouraged and I will stop about this nursing thing, and I don't want that to happen. Let me look for a
Yeah.
coach. I came across into you and I got one of the question you are answering. I got it in my exam and I saw the way you're explaining and I got it wrong because of what? I did not understand the word tighter.
Wow. Wow. That's
I
brilliant.
cried that day. I cried. I told my husband, this is the person I'm gonna look for. No matter what it takes, I don't care. I'm putting myself in, and I know he's gonna help me pass this exam. My
100%.
instinct tells me it's him, nobody else, and that's
Yeah.
why I looked for you.
Wow. I'm glad to hear that. And definitely,
Yeah,
yes, you are going to get that same transformation. Right. I'm
yeah,
glad to hear that. So, yeah, congratulations in advance because for sure, I definitely know you are going to pass it once you
yeah.
go through audio process. And I'm 100% ready to help you achieve that desired result.